On September 20, 2024, the Federal Trade Commission filed a lawsuit seeking $8.5 billion from CVS Caremark. The case centers on insulin, a life-saving medication used by millions of Americans with diabetes. According to the FTC's complaint, CVS Caremark, one of the nation's largest pharmacy benefit managers, artificially inflated insulin prices while simultaneously enriching itself through a complex rebate system. The figure, $8.5 billion, represents what the FTC alleges CVS Caremark extracted from patients and the healthcare system. To understand how we arrived at this moment requires examining the hidden machinery of drug pricing in America. CVS Caremark operates as a pharmacy benefit manager, or PBM. According to industry analysts, PBMs act as intermediaries between drug manufacturers, insurance companies, and pharmacies. They negotiate drug prices, manage formularies, the lists of covered medications, and process prescription claims. CVS Caremark, specifically, is the PBM division of CVS Health, one of three companies that together control approximately 80% of the PBM market. The FTC's complaint notes that CVS Caremark manages prescription benefits for roughly 90 million Americans. This positioning, the agency argues, gave the company enormous leverage over insulin pricing. At the heart of the FTC's case is the rebate system. According to the complaint, drug manufacturers pay rebates to PBMs like CVS Caremark in exchange for favorable placement on formularies. The higher the list price of a drug, the larger the rebate payment the PBM receives. The FTC alleges this created a perverse incentive. CVS Caremark, the agency claims, preferred insulin products with higher list prices because they generated larger rebate payments. These rebates, according to the complaint, were not fully passed on to patients. Instead, the FTC argues, CVS Caremark retained much of this money. Insulin presented an especially vulnerable target for this alleged scheme. The FTC's complaint notes that insulin is not optional for type 1 diabetics, it is literally life-sustaining. Patients cannot substitute another drug class or delay treatment. According to the American Diabetes Association, approximately 8.4 million Americans use insulin. The FTC alleges that CVS Caremark exploited this captive market. Because patients had no choice but to pay, the agency argues, CVS Caremark faced no competitive pressure to control costs. The complaint describes this as a market failure enabled by the PBM's intermediary position. The FTC's complaint contains specific pricing allegations. According to the agency, the list price of insulin products increased dramatically during the period CVS Caremark administered benefits. The complaint states that between 2012 and 2018, the list price of some widely used insulin products more than doubled. During this same period, according to the FTC, the rebates paid to CVS Caremark also increased substantially. The agency alleges CVS Caremark favored these high-priced insulins on its formularies, steering patients toward the most expensive options. The FTC argues this was deliberate, designed to maximize rebate revenue. The FTC alleges these inflated list prices directly harmed patients. According to the complaint, patients with high-deductible health plans or co-insurance pay a percentage of the list price, not the net price after rebates. Because CVS Caremark kept the rebates rather than passing savings to patients at the pharmacy counter, the FTC argues, out-of-pocket costs remained artificially high. The complaint cites examples of patients rationing insulin or skipping doses due to cost. The FTC contends CVS Caremark's conduct created a public health crisis, with preventable hospitalizations and deaths linked to insulin rationing. How did the FTC arrive at $8.5 billion? The complaint does not provide a detailed formula, but it describes the figure as representing the total financial harm caused by CVS Caremark's alleged conduct. According to legal experts analyzing the case, this likely includes excess rebate payments retained by CVS Caremark, inflated out-of-pocket costs paid by patients, and potentially treble damages permitted under FTC Act penalties. The FTC's authority to seek such monetary relief comes from its mandate to prevent unfair and deceptive practices. The $8.5 billion demand, if granted, would rank among the largest FTC penalties ever imposed. CVS Caremark issued a statement in response to the FTC lawsuit. The company denied wrongdoing and characterized the FTC's allegations as a misunderstanding of how PBMs operate. According to CVS Caremark's statement, the rebates it negotiates lower net costs for health plans and their members. The company argued that eliminating rebates would actually increase overall drug spending. CVS Caremark further stated that it has implemented programs to reduce out-of-pocket insulin costs, including caps on copayments. The company's position is that it is being scapegoated for broader systemic issues in pharmaceutical pricing beyond its control. According to court filings, settlement negotiations began within weeks of the lawsuit's filing. The proposed settlement, as reported in regulatory documents, includes both monetary and structural components. The monetary portion would require CVS Caremark to pay a substantial portion of the $8.5 billion, though the exact amount remains subject to negotiation and court approval. The structural reforms, according to sources familiar with the negotiations, would mandate changes to how CVS Caremark handles insulin rebates. These could include requirements to pass rebates directly to patients at the point of sale, rather than retaining them. The proposed settlement reportedly includes enhanced transparency requirements for CVS Caremark. According to sources reviewing the draft agreement, these measures would force the company to disclose information previously kept confidential. The transparency provisions aim to prevent future abuses by making CVS Caremark's pricing practices visible to regulators and the public. These requirements, if implemented, would represent a significant shift in how pharmacy benefit managers operate. The FTC has long argued that lack of transparency in the PBM industry enables anti-competitive conduct. Legal analysts note the CVS Caremark case could reshape the entire PBM industry. The FTC filed similar lawsuits against the two other major PBMs, United Health's OptumRx and Cigna's Express Scripts, on the same day it sued CVS Caremark. According to healthcare policy experts, this coordinated action signals the FTC's intent to overhaul PBM practices industry-wide. Any settlement with CVS Caremark, observers note, will likely set the template for resolving the other cases. The combined financial exposure for all three PBMs could exceed $20 billion, according to industry estimates. Patient advocacy groups responded to the CVS Caremark lawsuit with cautious optimism. Organizations representing diabetes patients issued statements praising the FTC's action while emphasizing that financial penalties alone would not solve the affordability crisis. According to these groups, meaningful reform requires structural changes to ensure rebates benefit patients directly. Some advocates expressed concern that even if CVS Caremark pays billions in penalties, the money may not reach those harmed by high insulin prices. They are pushing for the settlement to include a patient compensation fund, directly reimbursing individuals who overpaid for insulin. According to court schedules, the CVS Caremark case faces a lengthy timeline. The discovery phase, during which the FTC will compel CVS Caremark to produce internal documents, is expected to last at least 6 months. Legal experts predict the case could go to trial in late 2025 if no settlement is reached. However, most observers believe CVS Caremark will settle rather than risk a jury verdict. The company's motivation to settle, analysts note, includes not only the potential financial liability but also reputational damage from a public trial. A settlement could be announced as early as mid-2025. If the settlement proceeds as reported, diabetes patients could see tangible changes. According to healthcare economists analyzing the proposed terms, insulin users with high deductible plans would likely benefit most. The requirement for CVS Caremark to apply rebates at the point of sale would reduce out-of-pocket costs for these patients. However, experts caution that the impact will vary depending on individual insurance plan designs. Some patients may see no change if their plans already cap insulin copays. The FTC has stated that protecting consumers is its primary objective, but translating a corporate settlement into individual relief presents logistical challenges. Significant questions remain unanswered as the CVS Caremark case proceeds. Legal observers note that many settlements do not require the defendant to admit guilt, which could allow CVS Caremark to maintain it did nothing wrong while still paying. The allocation of any settlement funds between government coffers and patient compensation remains unclear. Enforcement of structural reforms also poses challenges. Monitoring compliance will require sustained FTC oversight. And fundamentally, some experts question whether penalizing PBMs addresses the underlying problem: drug manufacturers setting high list prices in the first place. The CVS Caremark lawsuit exists within a broader national conversation about drug pricing. According to congressional testimony, insulin prices in the United States are roughly 10 times higher than in other developed countries. Multiple factors contribute to this disparity, including patent protections, limited competition, and the complex supply chain involving manufacturers, wholesalers, PBMs, and insurers. The FTC's focus on PBMs represents one regulatory approach, but legislators are simultaneously considering bills to cap insulin prices, allow Medicare to negotiate drug costs, and increase generic competition. CVS Caremark's conduct, as alleged, is part of a systemic problem. The $8.5 billion FTC lawsuit against CVS Caremark represents more than a large penalty. It is a test of whether regulators can effectively challenge entrenched pricing practices in the pharmaceutical industry. According to former FTC officials, this case signals a more aggressive enforcement posture toward healthcare intermediaries. For CVS Caremark, the stakes include not only financial liability but potential operational restrictions that could reduce profitability. For patients, the outcome could determine whether insulin becomes genuinely affordable or remains a source of medical debt and rationing. The case, still unfolding, will shape drug pricing policy for years to come. The immediate next steps in the CVS Caremark case involve procedural motions and discovery. According to court filings, CVS Caremark has until early 2025 to respond formally to the FTC's complaint. Simultaneously, settlement negotiations continue behind closed doors. The public will likely not see the full scope of evidence unless the case goes to trial. Observers should watch for three key developments: announcements of a settlement agreement, court hearings on the proposed terms, and implementation of any mandated reforms. The FTC has committed to providing updates as the case progresses. For now, the $8.5 billion lawsuit against CVS Caremark remains in its early stages, with the most consequential decisions still ahead.